Hi, my name is Joyce Dominguez, and today I'll be performing administrating a tube feeding, an open feeding system, and a closed feeding system. So the first thing that we're going to do is verify our medical order. We're going to verify the type of formula, concentration, volume, route, rate, and frequency. Then we're going to gather our equipment, checking the expiration date on our formula. We're going to perform hand hygiene. Then we're going to identify our patient. Hi, my name is Joyce. Can you tell me your name and date of birth? We're then going to assemble our equipment, then perform an abdominal assessment. We'll position our patient at a minimum of 30 degrees, preferably 45 degrees. Then we're going to don our gloves. Then we're going to verify the placement in our tube, either by the mark on the nose on the tube or measuring the length of the exposed tube and comparing it to the documented length. Then we're going to check our pH. We're going to flush with 30 mL of air. Then we're going to aspirate a small amount, and we're going to check for color and consistency, and then check pH. Then we're going to aspirate all the stomach's contents. We'll then measure the amount and then return the contents according to facility's policy. Then we're going to flush our tube with 30 mL of sterile water. And with neonatal and pediatric patients, we're going to flush with the lowest volume possible. Then we're going to remove our gloves, perform hand hygiene, and then don gloves. And then we'll administer our feeding. Now with an open feeding system, we're going to label our bag and tubing with patient demographics, the type of feeding, the administration method, the time and date prepared, the time hung, and warning for enteral use only, not for IV use. We'll hang our bag on an IV pole 12 inches above the stomach, and then we'll clamp our tubing, and then we're going to prepare our feeding setup. We're going to check the expiration date of the formula, and then we're going to cleanse the top of the feeding container prior to feeding. We'll put the feeding into the feeding bag, prime the tubing, and clamp the tubing. We'll attach our feeding tube to our feeding setup, and then we'll connect it to our feeding pump. We'll set the prescribed rate, unclamp the tube, and then we'll flush with 30 mL of sterile water, either the feeding bag and the tube, or the feeding bag and the rise out of the feeding bag and tube. We'll clamp our tubing, disconnect feeding from the feeding tube, and then we'll maintain our patient's position in an upright position for at least an hour after feeding. With a closed feeding system, we'll check our expiration date, We'll label our bag and tubing with the same that we did in our open feeding system. We'll spike the bag with compatible tubing. We'll prime our tubing. We'll then put our tubing to our feeding tube, and then we'll put the tube through our feeding pump. We'll set the prescribed rate. We'll disconnect the feeding from the feeding tube and flush with a minimum of 30 ml of sterile water. And some of our important safety guidelines when doing this procedure: when we're making a reconnection, we want to trace the lines back to the patient, and we want to make sure that each reconnection is secure. As part of the handoff process, we want to recheck connections and trace all tubes, and then we want to make sure that we label all bags, warning for enteral use and not for IV use. We want to utilize enteral pumps, and with medications, we want to use oral syringes.